Yesterday's deadly shooting of a TV news crew outside Roanoke brings up questions about dealing with mental health in the workplace.
Yeah, and that includes knowing the signs of distress and how to address them. So joining us now is Tony Spann, a licensed clinical professional counselor and a member of the American Counseling Association. We're glad you're with us because there's so much to talk about. And initially, you say the key, at least, it's tough to nail down what exactly we had in this particular case, but overall, we need to be more aware, you say.
Right. And I'm glad that you brought that back up, because awareness in America is what we're really looking for, at least with the American Counseling Association as well as other mental health professionals. We really need to have a better awareness in this country. I think we talk about diagnosis, we talk about treatment, but what does it really look like? What is the process? Opening up for families in America as well as individuals and being comfortable in talking about the subject.
And are you, in that awareness piece, are you saying managers need to be looking out for certain symptoms and being willing to help their employees through these troubling times?
Yes, and I also mean as well as coworkers, as we're talking about managers. When we go into our jobs, we're there 8, 9, 10 hours of our days. Do we really know who we're working with? And saying, I need to know your name, or I want to get to know you, as I can tell the differences and maybe behavior or mood. If I don't really know you, I cannot really say that I saw a difference in you today. How are you doing? How are things going? Well as coworkers, as well as middle management, upper management, becoming aware on who we are and as humanistic viewpoints, and saying that I'm working with somebody, I see a difference, how are you doing? Be careful, I'm caring for you.
Mm-hmm. Few people, though, when they see something that troubles them or that they find a bit of a red flag, necessarily will feel comfortable going to a higher level and saying, this concerns me or this behavior concerns me. A lot of people don't necessarily take that next step. You would, I guess, encourage them to make sure they talk to others about it when they see something alarming.
And that's a good question, and I do encourage that. You can go to your human resource office and say, what is the policy here on, I see some concerns. How can you help me through this process or walk me through this process? Because mental health awareness on the job is important, and I do see that there are some changes in my coworker, or I see some changes in the environment that I'm working in, and what can we do as an agency or company to help that?
What about the intersection of mental health issues and access to guns? Should there be more public reporting of mental health problems? I know it's a touchy one.
It is a touchy subject, and it's also a complex subject, but, and just speaking from my opinion, I do believe that there should be more in the mental health awareness and what it is about gun violence. You know, a lot of times people want to then associate a strong correlation with mental health and gun violence, and that may not always be the case, but is there an area, is there a key place that we can look at in trying to prevent gun violence from individuals that may have a mental health background?
All great advice, and hopefully there are a lot of lessons that will be learned in a positive direction after this, so that we have few repeat performances. It's really just a tragedy, and we're glad that you can help advise us a little bit here. Thank you, Tony Spann.
Tony
Appreciate
Spann,
your time.
American Counseling Association. Thank you, Tony.
Thank you.